Alright, the male reproductive system. I'm Dr. H, and I'm going to be going through the anatomy, as brief as I can, of the male reproductive system in this video. I'm going to follow the objectives that I give to my students, and hopefully you find it helpful as well. So we're going to start in the major organ of the reproductive system, which is called the gonad. The gonad is where gametogenesis occurs, the formation of new gametes. And in the male, gametes are called spermatozoa. So where are spermatozoa produced? In the testes. Okay, the testis is right here. Inside of the testis, there's a bunch of tubes called the seminiferous tubules, and that's where spermatogenesis occurs. And it's surrounded by a whole bunch of white connective tissue called tunica albuginea, which is now surrounded by a harder outer casing, double layer of membrane called the tunica vaginalis. But you can't see any of those on this model, so don't try. You're going to have to look at histo or maybe a cross-section of the testes to be able to identify those tissues. Spermatogenesis occurs inside the seminiferous tubules inside the testis. And from there it's going to pass into another set of tubes called the ret testis, which are about right here, deep. And from there it's going to pass into the epididymis. The epididymis is this large worm or slug-like organ just superior to the testis. And this is where spermatozoa maturation occurs. It takes some time as it passes through the head, the body, and the tail. But from there it's going to pass into this duct, this tube that passes all the way up. Don't think that all of this is the tube. This whole thing's called the spermatic cord. But inside the spermatic cord is something called the vas deferens, or the ductus deferens. And that's where this mature spermatozoa is going to ascend by a whole bunch of little cilia and move it up into the abdominal cavity. So it's going to pass through, try to get in nice and close, right there. Okay, that is the vas deferens. And it passes all the way up. And it's surrounded by a bunch of blood vessels. There's going to be the testicular artery, which is the big red blood vessel, and all the blue plexus, called the pampiniform venous plexus, that surrounds the artery, surrounds the vas deferens, helps with cooling the spermatozoa out here in the testes because the testes need to remain a constant temperature. We'll see some other models that show some muscles that help with that function as well. Now, the spermatic cord contains all of these structures, the vas deferens, the blood vessels, everything. And that spermatic cord is going to ascend all the way up into the abdominal cavity. And in order to pass into the abdominal cavity, it's going to have to go through a space that divides the abdominal cavity from the external world out here. That space is called the inguinal canal. A bunch of muscles and tendons help keep that inguinal canal nice and tight, but if there's damage to that system, it can end up causing an inguinal hernia right here. You guys can look that up online. It's pretty nasty. Now, that vas deferens is going to wrap itself around this structure right here. And that's the bladder. So it's going to move from the posterior aspect of the bladder, and it's going to wrap itself around the ureter. That's the ureter right there, coming down from the kidneys. The vas deferens is going to wrap itself around before moving into that structure right here. This enlarged region right here, I'm going to go ahead and pull off this portion of the model and almost drop it. And you see, actually, that enlarged region right here is covering another group of enlarged regions down deeper. So this vas deferens dives down and into what's called the ampulla of the vas deferens. This structure on top is actually part of a vesicle system that produces semen called the seminal vesicles. What else can you see in this model? Seminal vesicles, the bladder, the prostate gland. Okay, and we'll see how semen is going to move its way through the prostate gland. From the prostate gland, it's going to end up passing down into the urethra, which passes through the penis, down through the shaft of the penis, to the tip of the penis, which is known as the glands of the penis. So all of those can be seen on this model. Let's pull this portion off. And now you're going to be able to see down. Give you a second here at this angle. Now you're going to see down into these structures. Now, this over here is the ampulla of the vas deferens. It's the opposite side of what we were looking at a little bit earlier, but this is the ampulla of the vas deferens. So during an ejaculation, the spermatozoa is going to move from the ampulla of the vas deferens into the first tube that's going to actually also catch seminal fluid as well. And this is called the ejaculatory duct, right there. The ejaculatory duct moves into the urethra. The urethra that passes through the prostate gland, which is this purple gland here. The urethra that passes through the prostate gland is called the prostatic urethra. From there, the prostatic urethra is going to pass down through the sheet of muscle called the urogenital diaphragm. This urogenital diaphragm is where we find a lot of our external sphincters, whether it's the external anal sphincter in the digestive system or the external urethral sphincter in the reproductive system / urinary system. Last thing that we can see on this particular model, okay, we are going to take and look at a cross-section of the penis itself. You'll see that there is part of the urethra that now goes down through the body and the glands of the penis. This tissue here is called corpus spongiosum, and so the urethra that passes through it's going to be called the spongy urethra. The spongy tissue up here, superior, technically anterior to the urethra. This spongy tissue here is part of two bodies of spongy tissue called the corpus cavernosum. I think the last little bit you guys are going to need to know is the exit. The hole is called an orifice. So this is going to be the external urethral orifice, and that's going to allow for, of course, both urine and spermatozoa to exit into the world around. I have another model that shows this system right here. So we can take and look at it from an anterior view or from a lateral view, and you can see quite a few structures on this. Okay, so we're going to go ahead and keep it as an anterior view for now. You're going to see some of the same structures I just went through. This now is the tunica albuginea. This is the white portion of connective tissue that surrounds the seminiferous tubules, part of the testis. If you look at the other side, we don't dissect away all of that tissue, so we're left with a bunch of smooth muscle that wraps up the spermatic cord. This is cremaster muscle that helps with the ascension and descension of the testis. The tunica albuginea, inside of there, again, is the seminiferous tubules, and now as new spermatozoa is produced, it's going to pass up into the epididymis, the head, the body, the tail, and move into the vas deferens. The vas deferens, again, goes up through the spermatic cord, up, through the spermatic cord, up through the inguinal canal, which is the space, is going to wrap itself around from the anterior aspect of the bladder to the posterior aspect of the bladder. And what you'll notice is this model does a much better job at showing the ampulla of the vas deferens, because there's the vas deferens and there are the ampulla. Just inferior to that is the seminal vesicle, and those two structures together are going to, during an ejaculation, eject part of semen, okay, semen, seminal fluid, and spermatozoa are both going to enter the first portion of tubing, and that's going to be called the ejaculatory duct. Can't see it very well at this angle. I'm just giving you guys a heads up on it. you could see it again from here, intact. So now, again, vas deferens wraps around the ureter. There's the ampulla of the vas deferens. Just inferior to that is the seminal vesicle. All of that is on that bladder. So now let's take and break this thing apart. Okay? And as we break it apart and look on the inside, you can see a lot of those structures there and a lot of those structures there. And we're going to end up using both of these models, I think, but let's primarily focus on this part of the model, because now on this part of the model you can see these two structures I just pointed out a little better. There's the ampulla of the vas deferens. There's the seminal vesicle. And those two are both going to end up secreting their structures, whatever they're after, right? Whether it's spermatozoa or seminal fluid, into that tiny little portion of tube right there. Okay, that little portion of tube right there is called the ejaculatory duct, which enters the prostate gland, then into the urethra that goes through the prostate gland. This urethra that goes through the prostate gland is the prostatic urethra. From there, it's going to pass down through the urogenital diaphragm, which is the muscle on either side. This portion of the urethra is called the membranous urethra. And it's then going to pass down into the spongy urethra. One more structure you guys are probably going to need to know about is this little gland that lies inside of the urogenital diaphragm in the male reproductive system. That's called the bulbourethral gland, otherwise known as the Cowper's gland. And this is what secretes pre-ejaculatory mucus that helps buffer and clean out the penis before an ejaculation. This kind of bluish purple, that's all part of the corpus spongiosum. It's going to extend all the way out to the glands of the penis. And above that is spongy tissue. There are two erectile bodies up superior and anterior over here to the spongy tissue. These are going to be part of the corpora cavernosum. You only see one side, so it's the corpus cavernosa. The very tip of the penis, external urethral orifice. That pretty much covers the entire male reproductive system. My recommendation for studying it is to write it in the order of flowchart from the formation of spermatogenesis in the seminiferous tubules through the ret testis into the epididymis, the head, the body, and the tail, up into the vas deferens, where that mature spermatozoa gets stored in the ampulla of the vas deferens. During an ejaculation, that mature spermatozoa are going to join seminal fluid from the seminal vesicle in the ejaculatory duct. From the ejaculatory duct, it's going to empty into the prostatic gland in the prostatic urethra. Prostatic fluid will join as well here. Then down through the membranous urethra into the spongy urethra. The bulbourethral gland has already done its thing, because this is going to be squeezed upon during an erection, so pre-ejaculation. Spongy urethra down to the external orifice. It's a really nice way to try to learn anatomy, is to find the flow of information, and then you could write it in the same order every time. Great study tool. Hopefully this is helpful. Find my next video on the female reproductive system, and we'll go through that together as well. All right, humankind, be both. Be nice to yourselves, be nice to your neighbors. Peace out.